Hello, my name is Javiera Troncoso, and this is a presentation on the topic of precision and predictive modeling for my Health Information Systems class. Throughout this PowerPoint, I will be guiding you guys through the assignment for the week. There are three main objectives for this assignment. First, we are asked to determine the relationship between anxiety diagnosis and the response to citalopram. We will also calculate the rate of success for citalopram. Second, we must calculate the rate of success of all the medications and determine which one has the highest rate of success amongst them. We will also be discussing why it is difficult to understand which medication works for patients with generalized anxiety. For the final part, we must determine which medication has the highest rate of success when the patient has a substance abuse diagnosis. We will begin by downloading the file needed to complete this assignment, which the professor has attached to this week's lesson. Once the file has been downloaded, it will open up an Excel spreadsheet with the necessary data and should look like the picture on the left. From here, we will locate the gray triangle in the upper left-hand corner of the sheet and proceed to click it so that all the data in the sheet will be selected. It should all turn green like the image shown on the right. Be sure to select all the data before moving on to the next step. Once that has been done, making sure that all the data has been selected, you will then locate the Insert tab and proceed to select the Pivot Table option as shown on the upper left picture. A box will appear immediately after doing this, and you just have to click OK. Once that is done, the screen should look like the image on the right, and the Pivot Table Fields box will open up. Next, we will begin by searching for generalized anxiety diagnosis in the search box and checkmarking it. It will first appear under the values field, but make sure to drag it over to the rows field as shown in the picture on the left. We will then search for CIT success, since that is the first medication we need to find rate of success for. Once that is located, you must check the box and it will also appear under values, but make sure to drag it under columns too. At the end of this, it should look like the image in the middle, and CIT success has to be in both fields for values and columns. After doing this, you must click the gray eye icon in the values field and be sure to select count. And remember that for all the other calculations for the rest of the medications, you must also select count as well. After following all those steps, this is what the final chart should look like. And from here, we will be able to calculate the rate of success of citalopram. To calculate the rate of success, you will divide 117 by 366 as shown in the image, and you should get 0.32 as your answer. You can use this formula I provided to simplify finding the rate of success on Excel. Just make sure to be clicking on the correct cells. For me, my cells were E7 and C7, but yours might be different, so just make sure to pay attention to that if you are going to be using the formula. For part 2, we are asked to determine which medication has the highest rate of success. To do this, we must repeat the same exact steps as we did to find CIT success, but this time we will be replacing it with the remaining 7 medications as listed on the slide. And make sure again to always click the gray eye icon and select count. So you're just going to do the whole process again, but this time we are going to insert BUP, SER, BEN, CT, MIRT, and NTP. Once all those calculations have been made, this is what the end result should look like. We were asked to find which medication has the highest rate of success, and from looking at the chart, we can see that CIT has the highest success rate with 0.32. For the second portion of part 2, we were asked to answer why it is difficult to understand which medications work for patients with anxiety. And in my opinion, it is difficult to understand because individuals have different reactions and tolerances to medications. One might work great for one patient, but another patient might have a really bad side effect to it. So you never really know exactly how someone could react to a certain type of drug. Another reason is that there are many ways in which a person can have anxiety. Some have mild anxiety, and others might have really bad anxiety. So there's more than one type, and what may give you anxiety is maybe not somebody else's reason. Also, some individuals might have other kinds of mental or health disorders and issues that can play into how they tolerate drugs. So there are a lot of factors that have to be considered when giving anxiety medication to a patient. There's not really a one fits all type of pill that can be given to patients with anxiety. For part 3, we must determine which medication has the highest rate of success when the patient has a substance abuse diagnosis. For this step, we will follow the same procedure as we did for finding the generalized anxiety diagnosis, but this time we will be using drug abuse diagnosis. So you just repeat the same steps for all the medications like before, and once you have done that, the sheet should look like the picture I have inserted here, with drug abuse diagnosis in rows, and I started with CIT success as the example, but you will have to continue doing it for the other medications. But this is what it should look like once you have started for CIT success. Once all of that has been calculated, the final results should look like this. We were asked to see which medication has the highest rate of success, and from looking at the chart, we can see that BUP has the highest rate with 0.38. Once you're done with that step, you guys have effectively completed this week's assignment. And I hope this video was helpful, and thank you for watching.